Good morning. Welcome all. Um, Welcome to today's webinar, Reproductive Trauma, When Trauma Becomes Relational, Understanding Emotional Dysregulation, Attachment Injuries, and Healing in Couples. I'm Dr.Irena, psychologist and certified EFT therapist and prospective supervisor. So if you're a mental health professional, welcome. If you are uh, EFT professional, welcome. If you're someone who has experienced reproductive trauma, welcome. We need you. We need people who are going to provide a lot of support for these couples who are going through this invisible trauma. So, the plan for today is that I'll be talking for approximately 20 minutes and then we'll have 20 minutes for Q&A. So while we're, feel free to drop off your question, like write your questions in the chat and I'll address them at the end. And I'll start by giving you kind of like following a couple. I'm going to call them Sarah and John, two partners. They've gone through IVF. A couple of rounds. She's older, so her chances are, lower, and they've experienced early second trimester loss. So same traumatic experience, but they're coping very differently. She's inconsolable. She's down. She's overwhelmed. She doesn't have, she doesn't feel herself, and he's back at work, um, very immersed in his work and appears to be doing fine. She's feeling alone. He's feeling completely, shut down. So, they're surviving in different ways. And while what protects one partner actually will end up hurting the other partner. And I do want to, talk about pregnancy as a very vulnerable state. There's so much happens, growth and change, during this time. Um, this is the time of, big identity reorganization, turning from, becoming a parent. There's a shift in kind of like how both partners feel about themselves, kind of like upcoming roles, changes. And I do want to say that they start to have representations of the baby. This is actually applicable for both partners. And I would say that this happens even when you're going from, pregnancy, like being a mom of or a dad of one to two, two to three, because there are always these changes happening. And this is also the time of heightened attachment to the baby and the future. So even in the in the first trimester, parents start to form attachment to the unborn baby. And I would say that this really happens even with the IVF when they start seeing the picture of the baby. I'm sorry, embryo, a slip, but they refer to it as a baby. And, for women in particular, this is the time of increased sensitivity to threat and uncertainty. And their perception of, they're very heightened to like stress, what's happening around them. And this probably has a very adaptive function because the more women are aware and sensitive what's happening around them, the more they can respond and, protect the well-being of the baby. And then, there are, of course, physiological changes like your body changes, for women, hormonal changes. And, even before, women start to kind of like, grow big and, like physically more uncomfortable, even from the beginning, they need more safety, reassurance, not only physical but emotional support from their partner. So this is also, they do depend on their partners more. And I will be talking about various types of trauma, traumatic experiences, infertility, pregnancy loss, stillbirth, fetal termination of pregnancy for medical reason as traumatic birth, NICU hospitalization, maternal or fetal complications, different. These are all different experiences, but they all have a similar impact on safety, attachment, and identity. And I'm not going to. I'm going to actually clump them together, so I'm not referring to any of these, separately. And all of these experiences that I've listed have a lot of characteristics of trauma, and I'm going to go over them. They most often represent sudden loss of safety and control, all except, I would say, infertility that's actually very chronic and insidious and kind of like long lasting, but most often they're unexpected, rapid, threatening, very, very threatening, and really leave both partners feeling at a loss and helpless. They represent, especially for the birthing partner, embodied threat to the body. There's very often physical pain, bleeding, medical procedures, invasive medical procedures. And as I mentioned before, this is the time when parents actually form attachment to the baby. So as they're forming attachment to the baby, they're experiencing the loss and rupture. And as I said, before, in the previous slide, that pregnancy is the time of heightened vulnerability during and so the loss happens at a time of like physical, emotional vulnerability. It leads to, nervous system dysregulation and overwhelm, and I'll talk more about that, later on. And most of these, experiences in reproductive loss, they're really unrecognized loss and grief, or we call it like disenfranchised, which means that they're not recognized, either of them, pregnancy loss, infertility, traumatic birth. They're not recognized, which means that there will be less acknowledgement, less social support in processing, the experience. And these traumatic experiences really shatter the sense of identity and meaning and future. So parents, feel like, well, I pregnancy leads to the baby. I was pregnant. I feel I'm a mom or I'm a becoming mom, but I don't have a baby. And so who am I? Am I a parent? Am I not a parent? Am I mom? So that leads to the confusion. And of course it affects couple, and I'll talk more about that. So I do want to notice that these traumatic experiences happen at the time, simultaneously affect safety. They affect the sense of safety, that, they impact the body, attachment to the baby, sense of identity and future, and that all happens at the same time, and it's very very sudden. And traumatic experiences actually lead to emotional dysregulation. The nervous system becomes overwhelmed, and we have most often like two, either emotional flooding or hyperregulation, panic, hypervigilance, intrusive thoughts, difficulty sleeping, or numbness, shutting down, not feeling anything. And of course, like increased reactivity will go into hyperactivation, and really difficulty returning to the baseline. Like emotions are so intense and so all over the place that it's hard to regulate. And I do want to notice that people are not failing to cope, but it becomes very difficult to cope when the nervous system feels overwhelmed. And both partners experience the same trauma, but what's different, and I want to highlight that they're expressing it differently. The birthing partner or mom will probably be more, emotionally and verbally expressive. Of course, when they're measured like higher levels of PTSD, but doesn't mean that, men are not experiencing that. They feel much more physiological, kind of like greater physiological and attachment related vulnerability, because especially for women, they maybe felt the baby, they experienced the pregnancy, and they will have much more like bodily experiences of traumatic bodily of loss and trauma. Because they have, again, they were pregnant, they've gone through labor, hormonal shifts, and non-birthing partners or fathers will most often suppress, minimize, shut down emotions. They use avoidant coping, going back to work, distraction, sometimes substance use, and they actually take on a support role. And I do want to say that study shows that they um, put themselves on the back burner, and they feel that their role as being there for the female partner, for their partner, and they feel that they often don't have right to grieve because they haven't experienced pregnancy or the loss or traumatic birth, and they're kind of like a second class citizen, But unfortunately, what that leads is to delayed and complicated grief, and even more feeling disenfranchised, meaning feeling alone and not entitled to process. So I do want to say different expressions of grief often conceal similar level of distress. So we don't know. The only thing we see is that they're expressing it differently, but we don't really see the inner experiences and distress. And this can lead, very often to partners misinterpreting each other's responses. So one partner will see silence and misinterpret it as you don't care, and not really, but the partner is really feeling is like, I'm trying not to fall apart. I'm trying to, especially male partner, I'm trying to, hold it together, not only for myself, but for both of us. What's going to happen if we both fall apart? One partner will see urgency, overwhelm, kind of like, crying and, yeah, overwhelm, and misinterpret it as you're overreacting, or we will there will be, that, be positive and reassuring, it's not really that bad, and won't see that, the partner is really feeling, I'm overwhelmed, I don't know what to do, I'm doing the best I can, and it's not working out for me. One partner will see withdrawal, distancing, shutdown, and misinterpret this. You're not there for me. You're not, you don't care about me. You don't care about the baby. You don't care about what happened. And she may not see that, he may feel like, I don't know what to do. I don't know how to help. And I do want to say that this same pain and different coping strategies and different expression will create disconnection and distancing among partners. And I think that this can lead to trauma cycle and between partners, meaning reproductive trauma. All of these different experiences that I've listed can will present a threat to this safety, body, attachment, identity, and they lead. This is the second cycle here, a circle: nervous system overwhelm and dysregulation, most often to flooding, anxiety, intrusive thoughts, or shutting down, numbness, you know, uh, exhaustion, disconnection, and misaligned or different coping styles. So one partner will reach out for closeness, need to talk. The other one will distance and avoid talking because he doesn't know what to do. And these different coping styles can lead to partners misinterpreting each other. So, as I mentioned earlier, silence can be misinterpreted. You don't care. overwhelm can be misinterpreted. You're too much. It's not really that bad. And this misinterpretation can unfortunately lead to defensiveness, disconnection, and distancing. So partners can feel profoundly alone and misunderstood. And unfortunately, what's really heartbreaking, alone in their pain. And this loneliness and can increase disconnection and conflict in the relationship. And that so disconnection and conflict can intensify, tension and lead to actually higher sensitivity to trauma. That not only that both partners are overwhelmed and coping the best they can, but now they're feeling alone and misunderstood and maybe, angry at each other. And their ability to cope with reproductive will be diminished. And I think, this is kind of like where the cycle, becomes a vicious cycle, and they're stuck in this, negative interaction, pattern. And uh, what may happen, not always, but what may happen that couples, they don't fall apart because they don't love each other. It's not about the love, but it's actually they can fall apart, they can distance, and because they don't understand each other's pain. And this is the situation where trauma can not only be individual, but it can become relational. And sometimes, trauma, this reproductive trauma can become attachment injury or attachment trauma. And for all, EFT practitioners, you'll know what it means, but it's actually just a definition of attachment trauma is perceived abandonment during a moment of critical need by someone you rely on for safety. And as I said, pregnancy, and anything related to pregnancy loss, traumatic birth, fetal distress, will activate fear, and of course, with fear, attachment needs. And, individuals feel, I mean, a birthing partner will feel seek safety and protection. And how her partner responds in this moment is especially important. So, it's not only individual trauma, what, the birthing partner experience, but can she find, her partner, and is he going to be empathic and responsive? Um, and, if the partner feels emotionally alone and that, unsupported, and she wouldn't be able to reach, this can lead to attachment injury. So, for example, back to Sarah and John, if she is, inconsolable, really feeling, bereft by the loss and feeling hopeless. And, at the time when I mean, would it be from the doctor's office or calling her partner from home, and she can't reach him, the whole day? This can, or if he's dismissive in the evening and says like, well, but what do you mean you couldn't reach me? You knew I had a, business meeting with my boss. And if he brushes her off and he's dismissive, this can easily turn into attachment injury. But, if they can actually talk about that, if he can actually come home and acknowledge and say, I am so sorry. I know I couldn't reach you. I couldn't respond. I know this was awful timing. I know you were in the doctor's office getting all of this news and I couldn't be there. I am so sorry. And I'm here, and, let me give you a hug. They'll repair it, and they'll move on. Or let me use like Sarah and John. If he insists on going on a business trip and completely dismisses her experience, even if the death is, any of the traumatic experiences, this can very easily turn into attachment injury. And she will say, this is, when things get hard, I can't rely on you. I really have to rely on myself. And this can color the relationship for years to come. So, in these situations of, overwhelm and dealing with reproductive trauma, Self-regulation is actually not enough. Trauma overwhelms the nervous system beyond the capacity for, what used to work, individual coping strategies, they used to work. Cognitive coping strategies, don't work. And let me actually move here because this is actually better. And I think for the sake of time, we can move on. So self-regulation means relying on yourself, relying on your own internal coping resources. And it's very difficult to access them at a time when the nervous system is overwhelmed and flooded. And cognitive coping strategies, thinking, reframing, breathing, gratefulness, journaling, they're all really great. We all need to have them, but they're not sufficient at a time of when we're, they're high level cognitive strategies. There we can access them when we're feeling, we're feeling emotionally flooded, like or panic. And I do want to say that they can very easily, if we insist on kind of like telling partners to cope on their own, this can lead to isolation. And I do want to say that this can lead, we can unintentionally shame women. So if we actually tell women, who've gone through any of these, experiences, be grateful, journaling, cognitive reframing. All of that is, again, very relevant. And she's feeling bereft, and still broken. And she can find her footing, and balance months after the experience. She will end up thinking and feeling something's wrong with me. I must be broken. And, so this leads me to, this is self-regulation is not enough. We really need to, we're wired for co-regulation, meaning co-regulating through emotional connection, through a sense of safety, presence, tone of voice, responsiveness of another person. And that really calms us down, calms the, overly active and agitated nervous system and creates a sense of I'm not alone. My pain is understood. And I do want to say safety and is not something we can teach, we can train, we can coach. It has to be experienced, through the presence of another one. So back to, this is the summary, slide that self-regulation is, it's relying on one's own ability to cope and calm oneself down is just not sufficient at the time of traumatic uh, experiences. We need to look in and help partners co-regulate through sense of safety, responsiveness, presence of another person. And I do have to say, we heal by being seen, by being understood, by being held in our pain. The pain doesn't go away, but at least you're not holding it alone. So let me move forward. What is it we can do? I think we can start seeing couples, at least offer that, offer as an opportunity that we can see couples together or seek therapy together, and that we, as you can see, reproductive trauma is actually dyadic. It affects both partners. Partners can cope differently, and this can lead to disconnection. Emotional dysregulation is common, and it really unfolds in the relationship. And understanding and unprocessed distress, pain, can really undermine the relationship for years to come, and it can lead to distancing, conflict for many years to come. And really, the best ability for co-regulation is actually happens in the in couples therapy. So for EFT practitioners or emotional focus therapy, I do want to say I do think this is a great model to approach, reproductive trauma. And the reason is that we know how to slow down trauma-driven reactions. We know how access attachment fears and needs that are, present. We know how to reframe different coping as protection, not as rejection. We know how to have, how to approach attachment injuries and we can create safety for co-regulation, safety in the couple. So brief takeaway: reproductive trauma is dyadic, leads to emotional dysregulation. Partners coped differently. Mismatched coping styles can lead to distance, and self-regulation is just not alone. Really, healing has to come occur through safety and responsiveness and co-regulation. And again, for EFT practitioners, these are ARE conversations. Accessible. Can I find you? Can I reach you? Are you going to be there and available for me when I'm in pain? Okay. So this is all. I ran a little over, so thank you for your patience. If you have any questions, please put them in the chat. I'll have them. Yeah. I forgot to mention, yeah, that you will be getting the recording, of this, webinar in within a week, so you can have it. And I'm definitely available, if you guys have, I don't know, any thoughts or questions, or you want to talk about particular experiences or cases. I'm definitely available to chat with you. Um, um, Let me move the slide so you can see. Okay, this is my contact information. I'm still available if you have any questions. This is my contact information. The best way to stay in touch is actually via email. I respond to emails very quickly. But I, yeah, let me know if anything spark any thoughts for you, or if you can relate to any of the things I was talking about.
It's I was thinking also that even during a healthy pregnancy, if other relational trauma happens, maybe there's a heightened vulnerability in, you know, attachment injury possibility, um, like discovering an affair while pregnant.
I will
Yeah.
be, I'm planning, I don't know what my next webinar is, but I'm definitely going to present again on um, some some form of reproductive issues and EFT, probably in the next couple of months. So if you're interested, I'll have another presentation probably early September, the end of August. Yeah. Uh, okay. Oh, um, well, thank you, Millie. I appreciate your comment. And the comment was that most couples don't fall apart because they don't love each other. They fall apart because they don't understand each other's pain. And that also resonated with Betsy. So thank you for the comment. And I think that certainly resonates. Thank you for the feedback. That resonates for me too. And I have to say, this is really what touches my heart. That these are people who are in a lot of pain. As much as healing can bring them together, it can also, you know, um, bring them apart. So I hope that, we as practitioners can help couples, understand each other's pain better. And if you're someone who's experienced, any form of reproductive loss, that you can have, really empathy for yourself and your partner, that you may be just dealing with pain in a different way. Um, um, We're almost at the end of the time. I don't see any other. I found it really helpful to highlight the different ways of coping with grief, how the may impact the couple's relationship. Thank you, Stacy. I appreciate I appreciate your feedback. So yeah, thank you. I thank you again for joining. You're all, yeah, and you will be. Um, Yeah, thank you for your feedback. I I love this topic, so stay tuned, and you will be getting the recording, and I really hope to see you soon in the next couple of months for the next webinar. Okay, bye all.